Alexandra Garcia, and I'm a nursing student at South. And today I'll be performing medication administration. I'll be showing you my ID to verify that it is me, and I'll be scanning the room with my camera. Okay, and now I'm gonna first I'm gonna plan for medication administration to avoid interruptions, which is do not take any phone calls, keep the medication room door closed, limit conversation with colleagues to only essential information, and follow agency no interruption zone policy. Next thing, I'm going to compare my patient care order form to my medication administration record. First thing I'm going to compare is the right patient. Jaguar J. Jones, date of birth is 8/25/1963, 8/25/1963, MR number is 4176352, MR number 4176352. Now I'm going to compare the right medication, Novolin regular insulin, dose is 10 units, and then the right dose is 10 units, right route is subcutaneous, right time is 30 minutes before meals, and right indication is for blood sugar. Now I'm gonna compare the allergies, penicillin. Now I'm gonna remove the patient care order form to the side, and I'm gonna perform hand hygiene. Now I'm gonna do my first check for my 7 rights of medication administration. First thing I'm gonna do is right patient, Jaguar J. Jones. Then I'm gonna do right medication, which is Novolin regular insulin, and I'm gonna grab my vial and compare it to my MAR record. Novolin regular insulin, and I'm gonna check for the expiration on my vial, which is 12/1/28, and I'm gonna show it to the camera. Okay. Now I'm going to the right route, which is subcutaneous. Now I'm gonna grab my syringe, and I'm gonna show it to the camera, and I'm gonna compare it to my MAR, subcutaneous. Okay, now right dose, which is 10 units. I'm gonna open my syringe. I'm gonna open my syringe, and I'm gonna grab an alcohol pad, and clean my vial, hopefully. Okay, now I'm gonna pull 10 units of air. I'm gonna open it and then puncture and push the air, flip the valve, and pull 10 units of insulin, and then hopefully you can see, and then take out the syringe, and I'm gonna scoop the cap so I can recap, and I'm gonna compare with my MAR the right dose, which is 10 units, and I'm gonna show it to the camera. 10 units. Now I'm going to do the right time, which is 30 minutes before meals. Right indication is for blood sugar, and right documentation, which is all elements and a legal prescription are included. And then I forgot to mention that when I do my 10 units, I would verify with the nurse to make sure that it's 10 units with another nurse. Okay, now I'm gonna do my second check for my right administration, my 7 right medication administration. And it's right patient, Jaguar J. Jones, right medication, Novolenol regular insulin, and I'm gonna compare it to my vial with the MAR, Novolenol regular insulin, Novolenol regular insulin. Okay, and now I'm gonna compare the right dose, which is 10 units, right dose 10 units. Okay, and now right route, which is subcutaneous, right time 30 minutes before meals, and right indication is for blood sugar, and right documentation is all elements and a legal prescription are included. And then I'm gonna I'm gonna label my syringe and put the dose, the dosage, drug, and the patient's name. Jaguar J. Jones, Novolent R, 10 units. Okay. And I'm gonna put it in my syringe. Okay, so I can bring this to the patient's room. Now I'm gonna perform hand hygiene. And I'm gonna move this side from me. You can see, yeah. Now I'm going to explain to the patient the procedure. Mr. Jones, today I'll be giving you your insulin. It's been 30 minutes before meals. And I'm gonna give it to you in your abdomen. Okay? And then I'm gonna raise the bed and put down the side rails, and I'm gonna I'm gonna do the first check, I mean the third check for right patient, and I'm gonna compare it with his arm band, and I'm gonna use 2 identifiers. Jaguar J. Jones, Jaguar J. Jones, date of birth is 8/25/1963, 8/25/1963. Now what I'm going to do is assess his allergies and ask Mr. Jones if he has any allergies other than penicillin, and he does not. Now I'm going to perform a blood sugar assessment on him before, and now I'm going to do the right medication. And I'm gonna bring my vial and my syringe and compare it to my MAR. Novolin N regular insulin, Novolin R regular insulin, Novolin R regular insulin, Novolin R regular insulin. And then now I'm gonna do the right dose. and I'm gonna compare it with my syringe, the label that I have in my syringe, which is the right dose is 10 units, and the right route, which is subcutaneous, and I'm gonna compare it to the syringe, which is subcutaneous, and then the right time, 30 minutes before meals, and right indication, which is blood sugar, and right documentation, which is all the elements in a legal prescription are included. Okay. And now I'm going to pinch. Actually, sorry, before that, I'm gonna put my gloves and my goggles. And I'm gonna clean the area. In circular motion. And I'm gonna pinch. Well, actually, I'm gonna open this and pinch the skin and do a subcutaneous route, which is what I'm gonna do is a 45-degree angle. And now I'm gonna dispose of this syringe on my sharps container, which is here. I think I got stuck with that. There. Now I'm going to press on the skin, and I'm gonna make my patient comfortable, and I'm gonna lower the bed and pick up my the side rails, and I'm gonna remove these goggles and this and now I'm going to do right documentation, which is document on the MAR, and I'm gonna actually check for any allergic reaction my patient might have, and I'm gonna also check for any I'm gonna come back to the room and reassess my patient if indicated. Okay.